During this presentation, we will be telling you about the therapeutic uses of diazepam, the mechanism of action, the routes of administration, the adverse effects, the drug-to-drug interactions, and what every nurse needs to know about diazepam.
Therapeutic use includes the purpose of the medication, and as a therapeutic use, the goal for the medication is to improve, treat, or prevent a condition. The therapeutic uses for diazepam are to treat anxiety disorders, alcohol withdrawal, seizures, and severe muscle spasms.
Diazepam binds at an allosteric site on GABA-A receptors on chloride ion channels. This type of binding causes hyperpolarization of the neuronal membrane and creates an overall less excitable neuron. When this receptor binding occurs in the limbic system, it causes sedative and amnestic effects.
Diazepam is administered by mouth, intramuscularly, intravenously, and rectally. Typical onset can be anywhere from 1 minute to 60 minutes and can have a duration from 4 hours to 24 hours. Diazepam generally peaks around 1 to 2 hours. Flumazenil is the antagonist used in the case of toxicity or overdose.
Here are the adverse effects for diazepam. The most common are dizziness, drowsiness, and lethargy, and the most severe would be respiratory depression because it's life-threatening.
Use caution when taking drugs known to increase or decrease the metabolism of diazepam. CNS depressors and opioids are known to cause serious adverse effects. Retinoir is also not recommended while taking diazepam.
Diazepam is contraindicated in patients with myasthenia gravis, severe respiratory insufficiency, severe hepatic insufficiency, and sleep apnea syndrome. The combined use of benzodiazepines and opioid analgesics increase the risk for drug-related mortality. Diazepam is a Category D pregnancy drug, so if a patient is pregnant or becomes pregnant, further consultation with their physician is necessary.
When caring for a patient taking diazepam, you're going to want to make sure to do an assessment of their mental status and presence of any seizures or muscle spasms. You're going to want to monitor their CBCs and their hepatic and renal function, and you want to keep a close eye on their vitals. Keep in mind that this causes drowsiness, so there's an increased risk for falls, and also instruct them to avoid alcohol.
In conclusion, diazepam is a fast-acting anxiolytic popular in use due to its broad therapeutic index, low toxicity, and improved safety profile. Nonetheless, diazepam is still a drug with high potential for use disorder associated with severe adverse and toxic effects.